Hi, and welcome to the Floating Doctors Preventative Healthcare Series, Building a Healthier Future. I'm Dr. Benjamin Brot, founder of Floating Doctors, and I'd like to share with you a talk by my father, Dr. George Brot, on some increasingly dangerous and extraordinarily common sleep disorders that frequently go all too undiagnosed.
Such an epidemic in this country that is so dangerous. Ever since they invented the internal combustion engine, it's become dangerous.
About price of CPAC, I was talking to Jeff there.
No, I didn't.
Do you want to?
Well, I'll tell you something. NTSB said if we treated everybody with CPAP who has obstructive sleep apnea, it would be cheaper than the cost of not treating people because of the cost of accidents.
But is loud snoring and a lot of snoring, is that automatically sleep apnea or?
No, but it has the same consequences as sleep apnea except for low oxygen. Because you have a huge outpouring of adrenaline in order to give you the oomph to overcome that resistance. You have huge fluctuations of intrathoracic pressure. You have a big vacuum, and then a big pressure, and then a big vacuum, and then a big pressure. So every time you have the vacuum, all this blood comes rushing into your chest through the great veins, and your heart becomes congested with blood. At the same time, you're sucking on your heart muscle, so it's hard for the heart to pump it out. At the same,
Isn't snoring like the first step to apnea?
Well, actually, not everybody with obstructive sleep apnea snores. But loud snoring is a known, it's certainly a reason to test somebody. And, by the way, it is almost impossible to lose weight if you have obstructive sleep apnea syndrome, because fragmented sleep causes your stomach to produce ghrelin, which is a hormone that stimulates your appetite, and it shuts off production of leptin, which is a hormone produced by fat cells that causes satiety. So it turns off the chemical that causes you to feel full, and it turns on the chemical that causes you to be hungry. And it is very, very difficult to lose weight if you have untreated obstructive sleep apnea. And many patients, when they start on their CPAP, do start losing weight because they stop making all this ghrelin and start making leptin.
We hope that you've enjoyed this presentation of the Floating Doctors Preventative Healthcare Series. And if you or anyone that you know seems to suffer from any of these conditions, we strongly urge you to seek your doctor's advice on how you can investigate and potentially manage this condition before it becomes serious.